everyone, and welcome back to Beauticians and Musicians. I am so excited about my guest today. He is a renowned plastic surgeon, and he is impressive because he's not only certified in one area, he's certified in 6 areas, which we're going to go in and let him tell you all about that. And we have before and after pictures of some of the work he's done. And what I love the most about him is, well, number one, he's got an amazing personality. But number two, he addresses the entire person. And Dr. Lee, I want you to kind of tell everybody about that as we get into it.
Okay.
But before that, I want to hear your story, and I know they do because I was really intrigued by how when you came to the United States and you were, 11 years old?
Yeah, right. you want me to go back that far?
Yeah.
Oh my God, that's like another century.
I know, right? Just, the highlights, the highlights.
Yeah, well, okay, so I was born in Korea, and I came to the United States when I was 11, landed in Boulder, Colorado. So for me, that's my hometown because that's where you landed, and I kind of grew up in Colorado.
Right.
And then we moved to New Jersey, of all places, and people in Boulder thought, it's like, New Jersey? That's like a whole other planet. Are you kidding? How are you going to live there?
Right.
So anyway, we moved to the East Coast, and I kind of grew up there, and went through high school and all that. And then I went back to Midwest to Cleveland to go to school, and then training in Detroit. So I've bounced around a lot.
Yeah, and so you're not only making people beautiful, but you're also a musician as well.
Yeah. So, I started piano when I was about probably 12 and a half, 13, kind of late, very late for piano. And the story is my dad bought a piano for my sisters. I'm the oldest of 5, so I have 3 sisters, and they thought, it'll be nice for the girls to learn to play the piano. It's like, they didn't have anything to do with it. It's like, I don't want to do piano. I'm the one that jumped in. It's like, oh my God, piano. I don't know what it was, but it kind of drew me into the music, and that's how I started. And somehow I got into the Cleveland Institute of Music, and actually studied music when I went to college. And but I realized I started a little late. 13 is not a good time to start piano if you want to have like a career or whatever.
Right.
So I decided, okay, this is probably not in my long-term plans. So I decided on the next logical step, which was going to biomedical engineering.
Yeah. I almost did that too. I almost did that, and then I decided, well, maybe not that.
So I graduated with engineering degree, and then was working as an engineer for several years, and then decided, okay, I'm going to go to medical school. So medical school was my fallback besides music. So that
Plan
was my
B. I mean,
plan
you got to have Plan B, right?
Yeah, exactly. So medical school was my Plan B, and that's kind of how the whole thing
And you
evolved.
love learning, and you've
Yes.
got 6 certifications.
Yeah.
Do I say that right?
Yeah.
You're board certified.
Yeah. I mean, they're different kind of boards. They do different things.
I mean, because you could just go get a quick certification, but you go all in.
Yeah.
And
you have to.
That's
You
what
have
I
to.
love that because a lot of people do a lot of things and they don't really know it well. I think.
Yeah.
And
Well, I think it's for me personally, as a professional, if I'm going to be offering, a service or some, new thing to my patients, I really need to feel personally that I feel confident. Okay, I really know to a certain level of knowledge and skill. So if I'm going to do something that I can produce consistent and good results, and number one, not harm anybody. Make sure you evaluate the patients properly. So everything that I do, I really try to train myself as much as I can. And maintain a certain level of competence and practice. So that's the reason. I mean I love learning. Obviously, my mind is always kind of seeking out new things, and probably has something to do with my ADD. But
well, hey, we get a lot done when we have ADD.
yeah, exactly. Multitasking. Learn different things.
Right.
Yeah.
So
that's
when
part
did
of
you
it.
get in? I know you do a lot of anti-aging
Sure.
too for the we're talking body, mind. I mean the whole thing. So
Yeah.
I know you do a lot with the brain.
Yes. Yeah. So all that's tied together.
Yeah,
Yeah.
it is.
I mean, I'm a cosmetic surgeon. That's kind of how I consider myself as my primary practice. But I've always thought that doing surgery on somebody who's not really healthy, it's really not a great thing. I mean, a lot of people obviously have surgery when they're not healthy because they're sick, but cosmetic surgery is something to make you, more beautiful, aesthetically enhanced and pleasing. You're supposed to be healthy. But I mean, there's so many times I see patients walking in, even for Botox and fillers, and I can see on their face, looking at their skin, they're just not very healthy.
Right.
So I would actually sometimes start coaching some of these patients about their diet and exercise and all those kind of things, and some of them look at me as like, I came here for Botox. What are you talking about? My tires.
Just put the needle
Just
in.
give me the Botox
Right.
and filler. It's like, let me out of here.
Right.
It's like, well, the reason I tell them that is because, listen, I can do these things for you. It will make you look a little better, but, you need to think about being healthy inside, because nothing beats healthy body, because you
Right.
get that glow, the inner health glow that comes out, and you can't hide that. I mean,
Right.
and there's nothing I can do as a surgeon to make that happen.
Right.
So that's why I went into actually additional training, got board certified in anti-aging medicine, regenerative medicine, and studied stem cells and all those kind of things, because I really thought, I can do operations to, do different things to make you look better, but I really want to get you to be a healthy person inside, so you can actually benefit more of the surgeries, that people are getting.
Get the longevity out of it too.
Yeah.
And the best result.
Okay, well, number one, they
best
heal
healing.
better.
Yeah.
The results are better. And then you have more energy and you're healthier, so you get to enjoy it more. So it's positive all around.
Instead of laying at home with a new Botox and filler.
Right, exactly. So that's
Yeah.
another reason. But, overall, those things are very, very
And like I
important.
came to you first because I had a neck problem.
Yeah, exactly. That's how we met, right?
And he fixed it. I mean, because, being a hairdresser, I have
Yeah.
chronic issues with back, neck, or, shoulders or whatever. It just kind of happens, that repetitive motion. And so also looking at your phone, I mean, we're probably going to get carpal tunnel in our
Yeah,
phone.
carpal tunnel in the neck, because everybody's doing this.
Right.
Yeah.
And then looking down all the time.
Yeah, you
Plus
should be-
doing
people should
hair,
be
I'm
doing
always
their
looking
phone
down.
like this, up this
Yeah.
way.
So, and actually it's helped a lot to do that, but you did some things for me there, and
Yeah.
that's
Good.
helped a lot.
Yeah, that's great.
And then, I recently went in again.
Yes.
Now, I just can't get enough of him, and I want to come to you for, hormone therapy, because I think that's important. We
Sure,
don't have to
sure.
feel bad.
Exactly.
We don't have to have hot flashes. We don't have to, what all the things are, well, I'm this age, so this is just going to happen. Well, no, there's a lot of things where you can
Exactly.
correct it and feel and look the best that you can.
Exactly. It's
So-
all about optimizing, at any stage in your life, what is the best you can be. I mean, obviously, if you're, 60 or 70, I mean, I can make you look younger with surgery and whatever, but, there's only so much you can do.
Right.
But, I mean, when people come in who are healthy, and it's amazing. I mean, some people just blow me away. They're telling me, I'm 62 or 65, and they look like they're in their 40s and early 50s. Like, oh, my God, what are you doing?
Yeah.
But they have good genes, and they have a healthy lifestyle. They took care of themselves. So because it gets reflected on their skin.
That's right.
And so that really is the ideal
And I like
situation.
what you said too. Is I don't know where I read it or talking to you or something. You said one of my biggest jobs is saying no.
Yes, exactly.
No,
It is.
this is not going to be
It
what you
is.
need.
Oh, yeah. In fact, a lot of my staff, they work with me, of course, and often they'll do a pre-consult and set all these things up, and I'll walk in and I'll say, well, no, you don't really need that. And they turn around, I was like, we spent 15 minutes consulting with this patient. But for me, it's really is optimizing what they have. I don't want to sell them things, for, whatever. I mean, obviously practice is a business, but for me, my primary concern is, what can I do to make you as optimized as possible? Doing as little as possible. And my whole pet peeve really is, we see this all the time. Is this Hollywood people out there, and you see
Overdoing
this in
it.
tabloids, and you see these pictures like, oh my God, what do they do? I don't know who they went to.
Right.
And for me, it's my job,
Yeah.
to guide the patients to the point of, let's optimize what you have rather than giving you everything you want.
Right.
Because
Or
some
what you
people-
think you want.
Yeah,
You may
some people
not
come
really
in and
want
they-
it
they
when
want
you have
this, They
it.
want that. They want this huge lips and whatever, all these kind of things. It's like, well, yeah, I mean, I can give you all the fillers and whatever you want, and, but do I really want somebody, walking out with that kind of result? And I always
Right.
tell my patients, I don't want my name on your face. And they kind of look at me, what does
Exactly.
that mean? It's like, well, I mean, if I do work and you look really refreshed and energized and everything is balanced, you look gorgeous, people are going to say, oh, wow, what are you doing? You're exercising or you're dieting or, man, you look great, right?
Right.
Well, but if I do all these things and you got these big lumps and these huge lips and all kinds of weird things, and people look like, well, some people are polite; they won't say anything.
Ew,
right?
what'd you
But-
do? I mean, a lot of people will
a lot
be-
of people.
it's almost like a-
especially your
a
friends and
knee-jerk
family. Yeah, it's
reaction.
like, oh no, what'd you do? Who did that to you?
Right.
Oh, Dr. Lee did. It's like, oh, that's the last thing I want.
Right.
Yeah, so that's why I say, I don't want my name on your face, because I want people to feel like I feel great. I'm very confident. I can go out there and I can face people. I can go to the meetings and I don't have to worry about, this little, we all have little insecurities about our looks.
Of course.
I don't have to worry about, how it's going to come across and whatnot. And But I really want to give them that feeling of confidence by optimizing them to look as good as they can without
Yes.
looking weird.
And you do a lot of teaching and
Yeah,
other
yeah,
people, your
yeah.
peers.
Yeah.
And you're always going to a conference somewhere.
Yeah, yeah. A few conferences to learn still. I still need to learn things.
course.
But most of it to lecture and teach and training people how to do
And we
different
have some
surgery.
really great photos. Let's see. Let's go with let's just start with the Restylane, which is a filler.
Yeah, that's a typical lip. I mean, lip I think, is a very artistic area, very difficult. Believe it or not, it's one of the most difficult areas to inject and shape properly. And to get the right volume, right size, how to balance,
Yeah.
the lips with the rest of the face. I think that's really,
I mean,
really important.
it almost,
So,
it just made her just look like a totally different
yeah,
person.
yeah, just the lip.
In a
I
good
didn't do
way.
anything else, just
Yeah.
the lip.
And just think if she got a little bit right here.
Yeah, well, obviously, she just wanted to come and get her lips
Yeah,
done.
sometimes you just want to start and just try something small, and
yeah.
then you can see. The thing I like about it too is like if you just had one crack, you could just feel it. It's
Yeah.
no one would ever
Right,
even know. You just don't keep cracking.
Sure, sure. Yeah, yeah.
And
but-
that makes a huge difference. And then
Exactly.
we have another one, I think.
Oh, yeah, under the
And that
lips,
just
yeah.
looks really natural.
Yeah, yeah.
No duck lips.
No duck lips. That's my whole motto. It's like no duck lips. I don't want anybody walking out with duck lips. Just a little,
No, yes.
plumped up, balanced, pouty lips,
Yeah.
which is what everybody wants. And so that's what I aim for.
That's good. I love that. That looks good too.
Yeah.
And the next one we have, let's see, just keep rolling, Ziggy.
Oh, this is a gentleman. Obviously the left picture is before, and then and the right one is after. And this is 2 hours later, actually. And just a typical guy. Hey, I look fine. I don't need anything. I look fantastic, and whatever.
And so there's different types of fillers for
Yeah,
different parts
yeah,
of the
different-
face.
yes,
For
yeah.
viscosity.
This is a combination of different fillers. And after he got the fillers done, he looked at me and was like, "Oh my God, I had no idea."
Yeah, it just
Yeah,
makes a huge
yeah,
difference, and it
yeah.
doesn't look weird.
No, but he
just
said,
looked
so
good.
how do you think about how you look? I said, "Oh God, this looks good." I asked him, "Do you think you look weird?" It's like, no.
Yeah,
And
no.
he just looks natural and refreshed, and
It's just when you start to lose volume in your face. We lose it in our face, and we want to lose it in our stomach.
That's right, exactly. Always going to the wrong places.
And then
There's
now
another
this
one.
is
Yeah, young
a
woman.
liquid facelift.
Yeah, liquid facelift.
Essentially,
yeah,
not
yeah,
a
it is. Yeah,
facelift.
it's not a full
facelift.
facelift. Yeah, but it's just, again, this little subtlety. It's just the elevation and reshaping, and kind of knowing where to place it. And,
Yeah.
And I was kind of thinking about myself in terms of, okay, what are you really good at? And it's like, well, not many things, but what are you really, really good at? And I thought, with the work that I do as a cosmetic surgeon and kind of things that we're showing, I thought, I'm really good at seeing through people. Not like Superman, X-ray
It
vision,
is an
but,
art, though.
to see through the
Yeah.
skin and the muscle and all the stuff,
Right,
looking at the bone
right.
structure. So when I see a face or a body, I can, quote unquote, see through and figure out what is the foundation.
Based on their anatomy.
Exactly. And how is your face, coming out because of the certain anatomy and the balances and imbalances that we have. We all have asymmetries in the bone structure. How is that affecting you? So you have to be able to see that
Right.
and analyze it, and then figure out, okay, from this, these are the solutions. Most efficient way to rebalance and bring up things to optimize and make them as natural but really beautiful as possible,
Right.
without going crazy.
Yeah.
But that's really the ability to be able to see that.
Because she just
yeah.
looked just better,
Yeah,
and then this lady, okay, Threadless is a really big thing right now. In fact, I
Yeah,
got
that's
to
like a mini
I got to
facelift.
listen to you teach that the other day, and I was just blown away, blown away. Since I knew a little bit about it already, it just and just listening to you teach that and all the detail and the precision and just everything,
Yeah.
and it was
The
just
little
amazing.
nuances, yeah,
Yeah.
yeah.
And it literally is a facelift
Yeah, it is. It is.
without
Without
having your face
surgery.
peeled
Yes,
off.
yeah. There's so many people they're in between.
Yeah.
You're aging, deflating, things like that, but you're not really ready for a full facelift. There's a lot of people in that middle zone. And this thread lift is really non-surgical, but is so effective. In refreshing and restructuring the face, that is beyond what fillers can do. Fillers do certain things, obviously, to
Right.
volume and whatnot. But, once there's a certain amount of aging, the tissue changes its position, the structure changes. And there's only so much filler can do to restore that.
Right.
So
You
that's what
can't
the
put
threads can
10 syringes in
do.
your face.
No, we don't do that.
Maybe 4.
Yeah, it just depends, But
Yeah.
the threads go really a long way to kind of help
Yeah.
you, reposition everything.
And kind of take the place of having to do a filler in some
Exactly.
instances,
Oh,
like
yeah,
you
yeah,
were
yeah,
saying.
definitely, sure.
That was amazing.
It's a nice way to kind of,
And then now we'll go into
even men.
Yeah, the men.
Even men, yeah, they do
And
that
it's
too.
not anything. It just pulled his face up right there.
Yeah. So we
It
all
looks
have that
so
problem.
much better.
Yeah.
And then I know you have rejuvenation, laser rejuvenation as well, and
Yeah.
you've got several different lasers, right?
Yeah, a lot of different lasers. I mean, I've been doing this for a long time, so I kind of know the technology, and having had an engineering background, kind of makes me a little bit of a geeky guy looking
Yeah,
at
he's
different
kind of
technologies.
geeky.
Right?
Oh,
Yeah.
here we go. Laser.
Yeah, so this is
That is
actually
so cool.
interesting. So I used I used the Photona laser. This is probably the only system that's out there that's probably capable of doing this. So this is non-surgery. There are a lot of doctors who actually do liposuction etching, with the cannula,
Yeah,
right?
yeah.
They actually go in through. But this is
So
all
this
done.
is just a laser.
Just all laser with no cutting of the skin.
And
down
so it
whatsoever.
goes deep enough to what? Melt the fat?
Melt the fat. Melt the fat. So I used my Photona laser to go actually carve out his 6-packs, and then use the laser to
I need
actually
some
melt.
6-packs, doctor.
Okay, come on in. To melt
That may
the
be the
fat
only way I'm
in
gonna
a
get
6-pack,
6-packs.
And then tighten the skin.
Yeah,
So I mean,
that's
it was done
amazing.
over a couple of different sessions, but I mean, you're getting a 6-pack.
So you do
without
the
cutting.
laser and then you tighten, or is it in the
Same time.
In the
yeah,
same
yeah.
process?
You're doing the fat melting along the the 6-pack
Mm-hmm.
margins, right? And then I do the skin tight over that. So I'm basically.
And was
causing
that
that
a
shape, right?
time? Was that like right after that other picture, or does that take a few weeks? Or
It takes a
is there
couple of
swelling,
weeks. Yeah, for
or-
the swelling, everything to go down, and you start to see the
Yeah,
the
wow.
change coming in. Yeah, it's pretty cool. He was very happy.
Yeah, I would say.
Yeah,
I
and there's
think
no downtime.
We have
You
one
come
more
in,
guy. I
get
think.
the etching done, and then you walk home. It's like
Yeah.
there's no surgery. So yeah,
That's amazing.
yeah.
Let's see. Is there one more, Zig?
Oh yeah.
Oh, lipo. That's a
this was
different
lipo.
one.
This was
Okay.
actually surgery.
Okay.
Yeah, this is actually surgery, and then I just did a little.
So if
just
they're
minimal
almost
etching.
there, you can do the laser. If they're
yeah,
really
exactly.
close to their
Sure.
goal, kind of
Right,
thing.
right.
Otherwise, you might have to do both.
Right, because sometimes there's too much fat, and you have to actually remove the padding.
Right.
And then you can go and actually kind of.
And then you can tighten and laser as well, which that's so much better.
Yeah.
I bet he was happy too.
Yeah. It's just kind of really kind of we all have men tend to carry this little
Right.
pudgy thing in the lower belly. It just won't go away.
Right.
know,
Especially
so-
once you get,
Certain
40,
age.
50, 60,
It's
like,
doesn't
good
matter
luck.
how much workout you do. So,
Right.
it just won't go away. So this is where the little minimally invasive procedures come in.
And then
So
this is
things
the
like
same
this.
type
Yeah,
of
same thing.
procedure.
Yeah. So
That's
that'd be a
hu-
big difference,
wow,
right? Yeah.
amazing.
Yeah, And you get the
Yeah.
tightening and all that. So kind of changes your dress size and how you
Oh,
look.
for
and
sure.
The silhouette of your body. All those kind of things.
And it makes you feel better and you have more confidence.
Exactly.
It changes
Yeah.
everything. Like
Yeah.
things can happen when you feel that much
That's
better
right.
about
Yeah,
yourself, just
exactly.
in your other life,
Yeah,
know.
yeah.
And then we have some photos of breast augmentation.
Oh yeah.
Which is a big deal in Dallas.
Yes, especially Dallas.
Dallas, and I know other areas, but Dallas is kind of known.
So
And-
this is actually a technique that I use called.
Okay.
I
Yeah,
do
that's
the
what
other
I wanna
techniques
know
called-
what that
This is called a
meant.
transumbilical. Okay. Some people call it the belly button breast augmentation.
Right.
So I'm actually placing the implant through the belly button. So I'm going from bottom up.
Right.
So there's actually no scar around anywhere in the breast, not in the armpit or around the nipple area or on the bottom. So it's a very elegant technique. I love doing it, and I think it's especially great for certain ethnic groups. This is Asian, Hispanic, middle, like a Mediterranean,
Yeah.
because they tend to have dark scars or they
Right.
keloid.
Right, right.
And so there's nothing worse than a beautiful young woman getting breast done, and all of a sudden they end up with a keloid on the breast, and it happens.
Right.
And you don't know until it's done. And now what? Now you got to deal with the keloid, which is a big pain.
Right.
And sometimes you just can't even deal with it.
Right.
So that's for a lot of patients. This.
And if they
belly
don't
button's
need a
great.
lift and they're young like these
exactly. I
girls,
know.
they just
Because you can
don't.
beautiful, nice shape.
Yeah.
And, no scar
So
whatsoever.
it's the same kind of
same kind
deal.
of transumbilical. Yeah.
awesome.
Yeah, I do other breast augmentation through the bottom and all those things too.
Yeah, yeah.
But this is a special technique. Not many people do this. Not many people do
That
this.
is amazing.
Yeah.
And now I know this laser, this Photona laser,
Yeah.
the 4D.
4D facelift.
Yeah, 4D. So tell me about that.
Okay. So there are a lot of lasers out there, for the face, obviously, doing fine lines and wrinkles and all those kind of things, and they do a lot of different things. But the reason I like the Photona is because it actually tightens the tissue on your face from the inside all the way to the outside. It's a full thickness. So you're actually doing the tightening from inside the mouth and then moving progressively to the outside. Okay, whereas most other procedures are only concentrating on the outside. It's concentrated on the skin and maybe the little, deeper layer around there.
Right.
Doesn't really deal, with the muscles and other deeper structures.
So am I a
And
candidate for that?
Yeah, of course. Your face looks beautiful. You don't
Well,
need, you don't
thank
need
you.
much.
But you gotta
But
maintain.
you want to start early and kind of maintain it rather than waiting for everything to fall, then try to lift everything up.
Right.
And I always
Yeah.
tell the patients, it's like fixing a house.
Right.
Okay. I mean, do you really want to wait for your foundation to fall before you fix it, or do you want to see it? Oh, it's starting to move a little bit.
Yeah.
Let's fix it early, right?
Got a crack in the wall.
Yeah, crack in the wall. You gotta fix it now, otherwise, So
Exactly.
kind of similar idea, but people, tend to kind of put that off.
Yeah, and one of the newest things, or I think it is one of the newest things you're doing, is the laser for the hair regrowth.
Yes. Oh, yeah.
combined
I'm glad you
with
mentioned that.
PRP, which you can also do on your face. And so I think everybody needs to know about that.
Oh,
Because
okay.
the PRP on your face, you actually put, you do the stem cells, or do you do their own blood
You can
plasma?
do both. You can do both. So PRP is, platelet-rich plasma, right? So that's from your own blood. So you draw some blood and you spin it down and get the platelets, and there's a certain level of platelets when it's concentrated. And when you inject it, into the body, within the face or whatever, they actually act like stem cells. They're not stem cells, but they actually attract stem cells. They have tons of growth factors and anti-inflammatory properties that really reduce inflammation and things like that. So that's the kind of benefit that you get. And you can put it on the face, obviously, after like a laser procedure. I use it in joints and ligaments and other things for pain.
Which
in
is
the
kind of how it
muscles.
started
Exactly.
there. And they're like, hey, isn't that how something
That's how it
else started in the
yeah.
cosmetic?
Yeah.
They're like, well, this worked in the knee.
Well, actually, Botox started.
Yeah.
That way. Botox started out with easing spasms in the neck muscles of little newborn babies, and then also people with a little tremor in their eyes. It's called strabismus.
Or
And they
what
control-
people get it for migraines.
Yeah,
and stuff
migraines
like
too.
That.
So that's how the whole thing started. But once they started doing the injections for migraines, people thought, "Hey, what happened to your wrinkles?"
Right,
The
right.
wrinkles went away.
They're like,
It's like,
hey, that's a
oh,
good
this
side
is
effect.
whole nother side effect.
Yeah, and so
that
the
could
same
be-
thing with the PRP.
Yeah, PRP, yeah. And then, so, the laser that I use, again, is photona laser. There's a special setting in one of the wavelengths that actually, if you, do the laser on your head, it really actually starts activating the dormant follicles. It's pretty amazing. And we think it's actually, we don't really know what it is, but we actually think it's we're creating a shock wave, releasing proteins and also releasing stem cells. Because there are stem cells around the hair follicle.
Okay.
Okay, and that's kind of what we're thinking we're doing.
So you don't know if it's dead until you try to wake it up.
Exactly, precisely.
And if it's not
And
a
it works
goner-
on men and women.
Right.
It's pretty amazing. A lot of women have.
So
this
we have
kind of
about 3 or 4 photos.
Yeah, different
But,
photos and things.
I
like
mean,
that.
I have so many clients that need this.
Yes, sure.
And so you, like that lady or this
new
guy.
guy, uh-huh.
So is this a combination? Because I
You
don't
can
think
do
that
it
one said.
the laser by itself, or if you want to actually even enhance result, I think adding PRP is a great way of doing it. So.
So you do the laser first, and
yeah.
then do the
So then I would
PRP
do it.
same
I
day.
would do maybe 1 or 2 sessions of laser first, and then do PRP. Wait a couple of weeks, and then go back to the laser.
So the laser kind of
Gets
wakes
things
it
going,
up.
yeah, and then the PRP
then-
goes in,
yeah.
and then you continue on with the laser.
And then you just go about your day again.
Yeah,
There's
pretty
no
much.
downtime.
There's no downtime. There's nothing. Yeah.
You just got to go in for 20
Yeah,
minutes
yeah,
or so.
about 20, 30 minutes. Yeah,
Yeah.
exactly. Yeah. Very
That's
simple.
amazing.
Yeah.
And then the one guy, I think it said it was, or lady, 4 months later. So, and she'd had two, is it called hair lace?
Yeah, hair lace,
And
yeah.
then 1 PRP.
Yeah.
And that's a big
I
difference.
know. Makes a big difference.
Yeah, it could save, actually, in the long run, ladies, you'd probably save money if you did this.
Oh, yeah.
And it worked for you, and you still have follicles that are dormant or whatever.
Yeah.
Then you would save money on some of the other things that you're having to do to
sure.
camouflage it or.
And then surgery. And a lot of people have surgery. And surgery is fine. Obviously, there are tons of hair surgeons. I'm not knocking them by any means.
Of course.
But so there's another, technique. I mean, there's a low-level laser technique. Who knows how many lotions and potions we have for the hair?
Right, right.
And you know that a lot better than I do. So there's so much out there. But the question has to do with, you're going to spend money, but what is the most efficacious, efficient way of spending your money so get
Right.
the most out of it? So that's all, person's different decision.
Because, people spend a lot on hair
Oh my
extensions and
God,
stuff
yeah,
like that.
sure, yeah. And
And you don't want to wait, like it's
it's
like anything
expensive.
else, you don't want to wait on all these non-invasive procedures because that can prevent you from not having any hair
Sure,
at all later or not being able to do anything but a facelift. You know, you may not have to do one for, I don't think anyone wants to do it if they could do something before it's too late.
Oh, yeah, yeah.
You know, or you put it off, or, you know, not that you wouldn't do it anyway,
Right,
but you wouldn't have to do it as soon.
That's right. No, I always tell people, start early. Start early and get proactive and kind of really figure out, okay, this is me. These are my genetics, okay? And so this is how my body reacts to certain things. And then really figure out a strategy. I always tell people when they come in for, fillers or laser, it's like, okay, so what is your goal? Where do you want to get to? Well, I want to look this way. All right. So there are a couple of ways to do. One is you can do it all at once, which means probably downtime and all kinds of stuff.
Right.
Or if you're a busy professional, it's like, I can't afford, a week off or whatever.
Right.
Then we have to do it gradually. There's a strategy. Okay. So then each session, you get more and more and more, but no one's going to know, ooh, Christy, oh my God, you did something done. You can walk into a
Just
meeting.
come in and get a plan of care going.
You can walk into a meeting and no one's going to know, but
Right.
you're gradually getting to your goal of, okay, this is where I want to go. So it's really important to, I think, have an idea in mind and then find, a doctor or other people who do this, who understands, your goal and can come up with a plan for you. Okay, so this is how we want to do it and work with you to get there so you can get the results you want, but in a very controlled, methodical, predictable way.
That fits your
Fits your
lifestyle.
lifestyle, and you don't have to be worried about embarrassed and all those kind of things. And then get into a maintenance system. Once you reach your goal, you're your hairstylist. I
Right.
mean, once you cut your hair, are you done for the rest of your life? It's like, of course not. Right? You got to go back and redo
Like
and
you don't
maintain
just
and
brush
all
your
that.
teeth once.
Exactly. You got to maintain it.
You got to do it every day, twice a day. You need to
Yeah.
floss.
That's right.
Which I used to be able to get away with not flossing, and now that's not the
Yeah,
case.
exactly.
So
So
you
we
just
don't
can't
do
get
that.
away with as
I
much.
know.
You got to eat right, and I need to have a nutritionist on here and a personal trainer. I mean, because there's just so much to do.
There are all those things. They all go together.
Yeah.
And that's how the maintenance.
That's how it works.
Yeah,
You got to
yeah,
do it.
I know,
Well, one of these days we'll get to, maybe you can play, accompany me, and I'll
sure,
sing.
I would love to.
We don't
talked
have a
about
piano
this.
here, but we got to do it.
Somewhere else. Yeah, maybe we'll do it somewhere else.
Yeah, that'd be fun.
Yeah, I know. It'd be great.
Super fun.
Yeah.
Well, it's been great having you
Thank
on the
you.
show.
Thank
I
you
mean,
so much for having
you've
me.
got to go see
Now
Dr.
you gotta
Lee.
sing for us.
Yeah, you got to go see Dr. Lee. He does hormone therapy. He does
Yeah.
so many things. Rejuvenation for, what would you call it?
Well, I mean, for the whole body.
For the whole body.
Yeah, not only hormones, but
Yeah.
nutrition, optimizing yourself.
Yeah.
Of course, we didn't get a chance to talk about the brain, but,
Right.
optimizing your brain
He's
as
been
well.
on,
That's
what's the show you've
It's
been on?
called Drew Pearson Live. And so, on Sunday morning, they have before the football game starts, it's a half-an-hour show he's been doing. So I've been going on there and talking about concussion, brain health. And things
Yeah,
like
brain
that. So,
health is,
yeah.
is big.
It's
I mean,
huge.
well, it always has been, but it's really big now. And the football players and anyone who's played sports,
all
no
the
matter
high
how
school,
old you
junior
are,
high school,
grade
college,
school.
oh
I
my
mean,
God,
concussions can happen and you don't even
Sure.
know you have it,
That's
right?
That's right.
And so he's very knowledgeable about that. And you have a brain scanner,
Yeah, brain
right?
scanner,
Which
yeah.
I would love to do that.
Yeah.
See what's going on up here.
Okay. Sounds good.
I am going to sing for you guys
Yes,
today.
All right. What a good.
I'm going to sing a song that I think everybody knows this song, and it's Somewhere Over the Rainbow.
Good.
Somewhere over the rainbow way, up high in the land that I heard of once in a lullaby. Somewhere over the rainbow skies, a blue the dreams that you dare to dream really do come true. Someday I'll wish upon a star and wake up where the clouds are far behind me. Where troubles melt like lemon drops away above the chimney tops, that's where you'll find me. Someday I'll wish upon a star and wake up where the clouds are far behind me. Where troubles melt like lemon drops away above the chimney tops, that's where you'll find me. Somewhere over the rainbow, skies are blue, and in the dreams that you dare to dream really do come true. If happy little bluebirds fly above the rainbow wide, oh, why can't I?
Bravo.
Thank you.
Great.
That song is so beautiful.
That's wonderful.
To me.
Yeah, I love your rendition. That's great.
Thank you.
Yeah.
Thank you very much. I appreciate
nice.
that. And I swear, thank you so much for
Oh,
coming
my
on
pleasure.
the show.
Thank you. Thank
You'll
you for
have to
having
come
me.
back.
Oh, I'd love to. Yes, of course.
And
Anytime.
we're going to be seeing a lot of Dr. Lee. He's like one of my new favorite people.
Yay, thank you.
And thank you guys so much for tuning in to Beauticians and Musicians. I'll be back on November 11th, the second Monday of every month, and I'll have an exciting new guest for you, and I can't tell you who it is. See you then.